Okay, Vevers. We hope everyone can hear us and can see our presentation. Let's wait for 2 minutes, okay? And then we can, okay, maybe 1 minute, just in case if anybody wants to join us. Can you see my presentation on full screen?
Yes.
Yes.
Okay,
Yes.
perfect. Okay, so maybe we can start with our introduction, and then we will talk a little bit more about our studies. So hello everyone, once again, nice to see you all here. It's a great pleasure and honor for us to have you here. I can see it's quite hot in your place, Jamal. Yes, it's really hot in here too.
Yes.
Summer just came a few days ago. So today the presentation will be given by me. It's Evgeny Razgulin. Yeah, I'm the teacher at the Department of Health Psychology at Lithuanian University of Health Sciences. Okay, please mute your microphones while you're not talking, okay? And also I'm working at the international office. Also, we have Rosa Joffe. Maybe Rosa, you can introduce yourself.
So hello, everyone. I am working in several positions in this university as a psychologist and also as a lecturer. So I work with both Lithuanian and foreign students. So today I'll also be sharing some insights about some possibilities for this profession, for career possibilities, and also maybe I'll share some experience as a psychologist.
Yeah. Also, Rosa is responsible for communicating with you, with those who are interested in bachelor and master in psychology. So most probably you already have got some emails from Rosa maybe. So now you can see how Rosa looks.
Not only emails, but also I see some faces with whom I have had interviews already. So yeah. Very nice to see you here.
Okay, nice. Yolanda, maybe you can introduce yourself.
Okay, my name is Yolanda Zielinski, and I also work as a lecturer in health psychology department. I also teach Lithuanian and foreign students about health psychology and family psychology. So that's all.
And also Yolanda will introduce you with specialization, which we have a master degree program, child and family psychology specialization. And also we have Aista. Aista, would you like to introduce yourself?
Hi, my name is Aista Pranskevičienė. I'm teaching psychological assessment, clinical neuropsychological assessment in master program. And I'm also a coordinator of neuropsychology specialization program. Maybe that's all.
And also Aista is working in Kauno clinics in neurology department, as I understand. Yeah, so and has a lot of experience in clinical work, as all Vevers, by the way, here. All of our teachers are working, most of our teachers as practitioners and as the teachers and scientists. Yunona?
Yes, I am also a part of the health psychology department at our university. I teach various subjects in bachelor's and in master study programs. That's all.
Thank you very much, Yunona. So here you can see some teachers who will teach you when you will come to study in bachelor degree or master degree in health psychology or clinical health psychology. How many people do we have? Maybe somebody would like to introduce themselves. If you wanna, you can. Okay, because we have...
My name is Frederick Krantz, and I'm applying for the master's degree in clinical health psychology.
Great.
I've been studying probably my bachelor in Marbella, and I'm aiming for becoming a clinical psychologist. So, but yeah, I come from Sweden.
Nice to meet you, Frederick.
Nice to meet you.
Others, if you would like to introduce. By the way, I have to inform you that we're recording this meeting because not everyone could join maybe today. So it will be on YouTube. Just informing that it wouldn't be a shock for you to be on YouTube without your permission. Okay?
No worries.
Okay. Jamal, maybe you would like to introduce yourself.
Yes. Hello.
Hello.
Hello. I am Jamal Bedardin. I am from Algeria. I had a master's degree. I work as a psychologist too. And I want to apply to study master degree in Lithuania in clinical health psychology. So I like the program of this university, and I want to do more information about, because I think the formation here is very weak, because we had like a weak program here in psychology. So I have to do more study and more research to psychology, because I love this field.
Okay, nice to hear, and we hope to see you here from September, yes. Jamal. Okay, we can see more people. If you want, you can introduce yourself and tell what you want maybe to study, then we will know what to talk more. It's not obligatory, but still, if you want, you can talk. Okay, I can see anyone else joining our conversation. So what we are going to talk today about LSMU. I'm not sure, maybe you have been to our open days, or you have maybe you got to know about our university, but still, as we're recording, so we will talk a little bit about our university for those who hasn't listened about it before. Also, we will talk about how to apply, why LSMU, and then we will continue with health psychology bachelor program and clinical health psychology master program. So I hope today you will get some information which will be useful and which will let you to make your decision easier. A little bit about the university, about the city, sorry. So we're situated in Kaunas city, which is the second largest city in Lithuania, and it has population of 300,000 people. So it's big enough. It has all restaurants, all facilities, all libraries, universities. It's a very academical city. But on the same time, it's not too huge a city, so it's very convenient. Distances between the objects are not so big, so it's very convenient to study here and to live. And it's only 100 kilometers from the capital city Vilnius and 250 kilometers from our seaside and port city Klaipėda. So on the weekend, you can travel easily to Vilnius or to Klaipėda, and it's not far away. And also this year, 2022, is the year when Kaunas is a contemporary capital of European culture. And we have a lot of festivals, a lot of exhibitions, a lot of action is going on here in Kaunas. And I promise you that it will not be boring for you to live here and to stay during your studies in Lithuania and in Kaunas. And why LSMU in general? So what students get from the university when they come here, it's student support, individual care possibilities, and especially at our faculty, our study program, we know each of our students by names and by faces, and it's like a small community, so everybody knows everyone and we can support when it's needed. Also, integrity of studies, research, and practice. Largest clinical hospital in the Baltic states, Kauno Clinics. Small academic groups, multicultural student community, quality assurance, complies with European Union standards, extensive mobility programs, and transfer of study results. As I said, we have a lot of support for students. We have mentors program. So the first students, we get one mentor who is helping them with everyday life and with adjustment to the university and to the country. We have psychologists who is working with international students and with Lithuanian students, also medical assistants, and different regular events like trips, freshers camp, introduction week, and many more. So we understand that coming to another country might be challenging, and that's why we try to help students to build their community, to build their social network system, that it would help to study and to adjust in new culture and new university better. Our university is also a part of Erasmus program from 1991. We have 170 Erasmus Plus partners in 31 countries, and our students can use 2 opportunities of Erasmus exchange. So you can go for studies to another country for 1 semester or whole year, and on the top you don't need to pay extra anything, and on the top of that you even get scholarship and grant, so you can even get some money for studying abroad. And also you can go for practice. You can find a clinic or another institution abroad, and you can do your internship there. For that, we have master program. For example, this first semester of second year is practice internship, and you can do it abroad, and you can get also scholarship, and you don't need to pay for that for sure. If you would like to stay in some other country, maybe that's not Lithuania, for example, after you finish your studies, maybe that's a good starting point for you to look for work and to practice your language. Talking about international students, in total we have around 8,000 students at our university. It's quite specialized university, and it's the biggest biomedical university in Lithuania, and one of the biggest in the whole region, this region of Europe. But when we're talking about international students, we have 1,000 or more than 1,500 international students from 87 countries. So even in psychology program, we have people from all continents, I guess, from Honduras, from Indonesia, from Africa, South Africa, from Sweden, Norway, Germany, Israel. So you can see that it's a huge variety of cultures, and people comes with different backgrounds, and which enriches us, because you cannot understand the other culture maybe without talking with people from different countries. And that will give you some intercultural communication skills, and you will get these beneficial skills. And we have 82 Erasmus students. It was last year, so it was there was some problems with COVID, of course. So this year the numbers will be much higher, and also we will have students from Erasmus even in our psychology programs. And in total, there is 23% of international students in total, compared with all the whole number of our students at university, and it is one of the most international. In Lithuania, it's the #1 international university and one of the most international university in the whole region, this region of Europe. So you will not stay alone, that's for sure. There will be more Lithuanian students and international students here. If you're interested in where our students comes from, so the first number, I'm talking not about our only health psychology or clinical health psychology program, but in total, the biggest biggest number of our students comes from Israel, almost 400 students, then Sweden. So those of you who are from Sweden, you will not be alone, that's for sure. From Germany, India, Spain, Nigeria, Lebanon, Lithuania, that's Lithuanians who have Lithuanian passport, because we are counting numbers according to passport and citizenship. So those are who are maybe born in the UK or Ireland, and we come to study in our international program, UK, Iran, Norway, and you can see all continents are marked because we have people even from Australia, New Zealand, and South Africa and America. And here are some alumnus. You can also see that the biggest numbers are from Israel, Lebanon, Sweden, India, and the others. Why we have so many students from different parts of the world? Because our diploma and our education is recognized in Europe, of course, in UK and USA, and in most of the countries of the world. And that's why students are not afraid to come to study at our university and to gain our diploma and to work later on, once again, in many places of the world. And shortly, how to apply. I guess most of you have applied already, but maybe I will just remind you that. First of all, you create your account on the site applying.lsmu.lt. You fill and submit the application. You are waiting for the feedback. Later on, my colleagues will give you positive feedback or feedback. If it's just feedback, there will be some comments that something is needed to add, maybe some documents are needed. If it's positive, it means that all needed documents are already there. Then you need to pay 150 euros for application fee. And that's a difference with many other universities, because first of all, we evaluate your documents and before you pay. So you don't need to pay anything for our evaluation, for our primary evaluation. Then you pay this 150 euros. If you are from a country which do not belong to European Union, then in most cases, your documents will be sent to the Center for Quality Assessment to be sure that your documents your study are done according to European requirements, let's say, and that you can continue your studies in master program. And here I'm talking about those who are applying for master program mostly. Then we have motivational, if everything is okay with your documents, then we have motivational interviews, and most of you had interviews already with Rosa or will have an interview with Rosa. Everything went well during the interview. We are sending you the offer letter. And if you agree to continue with the application procedure, we will send you the contract. And if you agree to continue, once again, you pay 250 euros. With that paying, you show that you are still interested in our study program. And then you need to pay 1,000 euros, which is a deposit for the studies. And this deposit will be included into study price. So it's not something extra, it's just a first part of tuition fee just to guarantee you the place and that you are really coming for studies. After that, my colleagues will send you the deadline till which you need to pay the whole tuition fee. After you paid your tuition fee, my colleagues, once again, who are responsible for migration issues, they will send the mediation letter to embassy where you are applying for visa. If you need, of course, if you are from European Union, you don't need visa, that's for sure, because we are part of Schengen and European Union. But if you still need visa, then you apply and you get national visa D in embassies of the country where you are from or from some other neighborhood countries if in your country there is no Lithuanian embassy. And also in some countries like Nigeria, we don't have embassy, but there are some visa centers. So you can apply there and you can get visa from that place. And that's all. Many students are asking if we can apply for visa before paying tuition fee. So the answer is no. Unfortunately, you have to pay your tuition fee. Our embassy should be sure that you are really coming for studies. and that's why everybody have to do that before getting visas. My recommendation would be to start with application, with paying all the tuition fees and everything as soon as possible, as for some countries, it takes time to get visa. Okay, it might take a month or 2 months. So if you want to start studying on 1st of September, you need to do it from before. Somebody is, I don't know, they apply quite early, let's say now, and we pay only on 31st of, I don't know, August, and then we have to wait for 1 month or more till we get visas. Okay, so that's very important part. If you are sure about your studies, just continue with procedure of application, and then you will succeed and will be on time. And you are getting then, for those who are not from European Union, you will get a visa D, which is very similar to Schengen visa, but also it gives you even more possibilities for 1 year, not longer. And with this visa D, you can, and I said that you will get it after applying and paying tuition fee. That's shortly. Do you have any questions about university, Kaunas City, or application procedures? Maybe we can answer right now.
Yes, I have one.
Please.
I have one question about the tuition fee. We pay all the money or just a part before the visa?
Yeah, so first of all, you may pay deposit 1,000 euro, but if you apply for visa, you still need to pay whole tuition fee. And that's for the first year. For second year, you can pay half and half. You are paying for 1 semester. But for the first year, for the embassy to be sure that you are coming here for study, not for the other reasons, you need to pay whole sum of money.
Okay, thank you.
No worries, but from the second year, you can pay only for half of your studies for 1 semester. More questions?
Is it possible to, will I prolong my visa for the second year of studies?
Yes, easily. You will get not even visa, but you will get temporary residency permit, which will let you to be here. You can apply for normal insurance and for many other things. Also, what I didn't mention yet, but which is very important, that after finishing our university, your studies, after gaining your degree, you will have a possibility to stay in Lithuania for 1.5 years. So you are studying, for example, 2 years here, and you would like to stay in Lithuania for work, or maybe you are looking for work in some other European countries, you can still stay here and look for work, maybe study the language and prepare for your future career. So that's very important. Not all the countries in Europe, I would say very few countries in Europe has such migration policy, which is very good for international students. In some countries, you need to leave immediately after graduation. Okay. Any more questions, maybe? And for those who are from Israel, for example, so you can come here without visa and you can stay here for 90 days. But at the moment you are coming here, please apply immediately to immigration office to get this temporary residency permit, because usually it takes 2 months or more to get it. So if you think that on 18th day of your stay here, you will get permit immediately, it will not happen. But my colleagues will let you know about all those details, okay? So you can come here without visa, but later on you need to apply, or you can apply immediately in your embassy in Israel for this residency permit.
Evgeny,
yes.
One participant, Amira, has a question in the chat, please. And he asks that he might get his diploma only at the end of the summer. We had interview with him already, so is it possible that he comes here on time? That's his question.
Okay, so thank you for a good question. First of all, for everyone, if your diploma will be issued later, it's okay. We're still trusting our students. For example, many of you might get somewhere in the end of August, but you know that you did everything, you graduated successfully, so we can enroll you. You can start your studies here, and you can pay it. But if you get it if during the first 2 months you are not presenting your diploma, for example, then we will need to expel you from the university, yeah, because we don't see your diploma. So we trust our students, we can apply, we can continue with procedures, we can get everything. You can pay for, even without diploma, you can pay tuition fee. You come to university, you're studying, and in September or October latest, I guess you will get this diploma and you just ensure us and you present it and you continue, okay? But of course, if during the study year we will not see your diploma, we will need to expel you till the moment you will get it. I hope we answered your question. Is there anything else to ask? Okay. So if you will still have any questions during my presentation or my colleague's presentation, you can write or you can ask it. So now I am going to talk about bachelor program in health psychology. Okay. But before starting, I would like to ask you a few questions. Very simple, I guess. Not questions, but I will read some statements and please let me know which answer is right. You can write it on in our chat. So psychology is a science of human mind and behavior. Please find incorrect statement. So first statement is psychology is a science of human mind and behavior. Second, psychologists can work in hospitals, universities, laboratories, business companies, and other places. And psychologists only work with people who have mental health problems. Please choose the right answer, and you can just write, I guess, in chat box your answers.
So choose not the right one, but the one which is incorrect.
Incorrect, exactly.
I think the two first are correct and the third is not correct.
Okay, good. Let's wait for the others. We have two more. Third. Okay, I guess it wasn't difficult, especially for those who are already studying Bachelor of Psychology or working already. So yes, you're right. The third is not correct. We're working with all people and not only with those who have mental health, and in total it's only a small part of our client who have mental health problems. Some formal information about the program. So it's 240 ECTC credits, which is European system credits. It's bachelor after graduation, you will get a bachelor in social sciences and health psychology. Minimal education requirements are to have good grades at school for mathematics or biology. We're looking for your transcript of your each year program, let's say, and also for your state exams if you have such. Okay, so we are looking for at least one mathematic grade in the year which you got for the lessons and favors for the exam. And biology. If you didn't do biology or mathematics, I guess everybody did, but still at school or your grades are not so high, then we have the entrance test. So for entrance test, you have 30 questions in biology, 15 questions in mathematics. You are doing it, and if you succeed it well, you can get a place at our university. So two ways. One, to get good grades, good enough grades from your school or your exams, and second, to do the entrance test here at our university. Usually we are doing online exams. And also we have a study fee, which for bachelor degree is 5,590 euros per year. Why our university? So degree is recognized in Europe and most of other countries, as I mentioned before, and the program is prepared according to Europe PSI requirements. So most of the studies in Europe are organized according to those requirements and were recognized by European Association of Psychologists. And the program is highly recommended for those who are planning to work in health or medical field, but also for the others. A lot of attention is paid to analyze mind and body connection links between biological and psychological processes. And also you will learn to work in a team with the other healthcare specialist. And university provides lots of opportunities to develop practical skills in various healthcare, education, and occupational areas. Talking about the lecturers will be given by psychologists of different fields. Therefore, lectures will be based on not only theoretical knowledge, but also on a lot of practical applications and a lot of skills. As you could see also at the moment, we have different lecturers and professors from different fields of psychology. So they are working not only in our Department of Health Psychology, but also in clinics and in other organizations, and they are specializing in their fields. And also we are cooperating with the other departments and clinics and hospital doctors. So medical lectures will be delivered by practicing doctors. So usually we have some courses, so some part is medical part, some information about oncology. Diseases are given by medical doctors, for example, and psychological part are given by psychologists. And here are some main subjects which students will study in Bachelor of Health Psychology is psychology of communication, personality psychology, experimental psychology, cognitive, social, clinical psychology, psychology of crisis, counseling, group psychology, developmental psychology, family psychology, work and organization psychology, and psychiatry. And there are many elective and general courses of the university. And as you can see, even from those main subjects, we're giving a very strong basis in psychology. So after finishing our study program in health psychology, you still have possibility to study in the other branches of psychology, not only in health, clinical or health psychology, but you will be prepared much better from studying in our clinical health psychology or in the other clinical psychology programs. Also, there are a lot of practice. So you will have to do some internship, small internship of few weeks in educational psychology field and psychological assessment and psychological counseling and some supervised practice during the years of your bachelor studies. And you can do this practice in many places. So you can do it in hospitals and some schools and some other organizations. And what is good that we're providing our students with practice places in Lithuania. And also, if a student wants to practice somewhere abroad, he needs to find this place, of course. We are helping, but we are not providing those places, but we are supporting with Erasmus scholarships and grants. And of course, after graduation, you can continue, for example, in our master program in our clinical health psychology or in the other study programs of psychology or the other social sciences. What you can work after graduation, so you can work in some projects, work as assistant psychologist, as research assistant, or human resource in human resource area, and also you can work in health, social, educational, and organizational sectors, or continue your studies in master or even PhD studies. For example, in the UK, you can jump directly to that study program. What I didn't mention till now, but what also we got some questions before, that can you start working maybe during your studies, so you can do it. And for bachelor study program students, you can work 20 hours per week. It's half day work. And for master study programs, you can work 40 hours. So that's full day work, but don't forget that you're coming for studies. and we're flexible, but not as flexible to accommodate everyone who are working for whole day. It's not possible. Is there any questions? Because I cannot see the question. Oh, now I can see no questions. Anyone
No questions on the chat here, at least.
Okay, so I would like to continue with master program in clinical health psychology, and my colleague Rosa will introduce you with this program, and other colleagues will introduce you with specializations.
Okay, so thank you, Evgeny, for the introduction and for the bachelor program presentation. So I will continue with presenting our clinical health psychology program, and as I understand, at least here who are present, most of you are interested specifically in the master's program. So I will tell some things, but my colleagues are welcome to add if I miss something or if I forget. And of course, you are very welcome to ask questions. Okay, so let's start with some formal information. So here is just some basic information for being eligible to this program. So program capacity is 120 ECTC credits. The minimum requirement is to have a bachelor in psychology, because sometimes we get questions, students who have bachelor degree in some other fields and they want to study their master, to do their master's in psychology, so they are not eligible because this is an obligatory requirement. So you have to have your bachelor in psychology. Okay, let's go next. So in general, is such program recognized? So Evgeny already told you that our university's diplomas and our program diplomas, they are fully accredited and fully recognized. You can use them worldwide. Of course, each country has its own regulation for medical psychologists, but it's not related to diploma. So what concerns our diploma recognition, it meets all the requirements. And what we noticed that the need for health psychologists, for clinical health psychologists, the need is drastically increasing, and we have noticed that even before the pandemic situation. And the pandemic only showed that the situation might be even worse when we talk about well-being of people, and not specifically just mental health issues, but in general. So what we see that the demand is increasing, and I don't know if it's subjective or objective, but for sure with this diploma you will be needed, if I may say so. But this is what I see. And okay, we can go next. What will your program consist of? So here you can see a list of modules of subjects that you will have to pass. So as you can see, it will be behavior, stress and health, for psychological counseling, clinical psychological evaluation, and many more. In your first year, you will start writing your master thesis. As you can see, you will have your professional practice in the second year, and your professional practice will probably be related to the specialization that you will be having. So as Evgeny mentioned, you will have to choose the specialization. So for you to be able to do that decision, we'll briefly introduce all 4 specializations shortly, and also you'll be able to ask questions if you have any specifically about those specializations. So in the next slide, you can see once again. Evgeny, can you hear me? You're muted.
Yes, I would like, sorry to interrupt you, just letting everybody knows that the first year will be, your studies will be at the university, and it will be face-to-face studies, but the second year will be mostly outside the university, so you will do some practice in Lithuania, or outside Lithuania you will have more even than 1 month of practice, 1 semester of practice, you can do it even more. So you can do it outside and to get scholarship, and then the last semester will be given to finish your master thesis, and only one elective course will be added in this program. So that's good for those who would like to stay for 1 year in Lithuania and then to continue their practice and some other activities outside Lithuania. Thank you.
Thank you. And also, I'd like to mention that during the study of different modules, different departments of LSMU are involved in providing the studies. Some of them are the Clinic of Oncology, Behavior Medicine Institute, Neuroscience Institute, Neurology Clinic, Cardiology Clinic, Psychiatric Clinic, and so on. So here you can see those 4 specializations that we offer, and just I want to say that it's like something extra, like a bonus that we offer next to regular master's diploma. And also for those who have questions or concerns about the career opportunities, what a health psychologist can do. So here you can see, of course, not the full list, but just several fields mentioned, how you can use the obtained diploma. So you can work in specialized clinics or rehabilitation centers, mental health centers, crisis centers. Also, I don't know if this term public health bureau is common for you, if it's relevant for you. We in Lithuania have such institutions. They cover many different areas concerned with public health, public well-being, and in those each of that bureau or center or institution also has psychologists, and sometimes what I know is that they use extra psychologist services because the psychologist who is there is not enough for them. So this is really quite wide range of services that they organize, many initiatives oriented in general towards changing the society's health assumptions, health attitudes, behaviors, and so on. Also, of course, you can do private counseling, group counseling, you can work in organizational sectors, schools, law enforcement, universities, scientific laboratories, and many other fields. So now let's go through each of the specializations briefly. So the first one is specialization in oncopsychology. So basically, oncopsychologist is a psychologist working in the field of oncology. So it relates helping not just to those patients or to those people experiencing this disease, but also to their environment, because it touches and it involves their families, their closest people, and in many cases, those close people, they also need help, they also need knowledge, they also they can feel lost, they need some advice how to communicate with the patient, how to support him, how to help themselves to be next to that patient, to go through that process, and so on. So this specialization will cover such aspects as how the experience of oncological disease affects the person's psychological well-being, what psychological reactions are common for patients and their relatives at different stages of oncological disease, what methods of psychological health can help to improve the quality of life in case of oncological disease, and similar questions. And of course, you will be visiting different places. In the next slide, you can see how will those institutions look like. If Evgeny could move to the next slide. So at the very up and on the left side, You can see our faculty, where you would be having the majority of your lectures, but all other pictures are hospitals, clinics, also National Cancer Institute, clinics. Also, here you see hospital in Vilnius, in the capital, also, who has many very significant specialists on that field, and so on. So really obtaining your practice and seeing practically how oncopsychologists work, you will be visiting different places, and you will see how actually the work goes there. Working in a team, meeting, because usually oncopsychologists, they work in a team, they have to contact physician, oncological doctors, and to gather many more information that would help them to provide adequate help to the patient and to the patient's environment. Okay, so we can go to the next specialization, which is rehabilitation. So again, the need is evident and undeniable. The World Health Organization predicts that by 2030, the main 4 mortality causes will be ischemic heart disease, depression, AIDS, and traffic accidents. And what we see is that the growing number of survivors the growing number of people who survived, who recovered after those diseases, the growing number means sometimes a lifelong rehabilitation process that they might need after that recovery. So with the increasing quality of health, of medical health to those people, at the same time, the number of rehabilitation specialists and psychologists is also increasing. And in the next slide, you can see a list, just an example of areas of work for rehabilitation psychologists. So in the next slide, Evgeny, we can show that those areas are children with developmental disabilities, people who experience brain injuries, spinal injuries, also aging people, people with chronic diseases, also people with nervous and muscular disorders, people experiencing chronic pain, and people in certain medical conditions such as multiple sclerosis, developmental disorders, disability due to psychiatric illness, substance dependence, deafness or hearing loss, intellectual disorders, blindness or loss of vision, disability due to learning and other difficulties, and many others. Okay, so we can go next. And now I think my colleague Jolanta will tell a few words about this specialization.
Jolanta, you can share your screen.
Yeah. Okay, we'll try. So, start beginning. So I'm very glad to present, to introduce specialization child and family psychology. Because I believe in its importance and value, no matter what problems you are working on the family theme is very important, and constantly will be touched upon. The work of psychologists with children and family is very important, and because prevent further future problems. So about specialization aim, it is the aim of the course is to help prepare psychologists to provide psychological counseling to children and their families in the field of clinical health psychology, to deepen knowledge, abilities, and skills related to child clinical psychology, family psychology, child and family psychological assessment, professional cooperation. So our themes are systematic approach to the family, situational crisis in the family, systematic assessment of the family, family psychotherapy, main schools of family psychotherapy, principles and methods of practice, child and family welfare system, interinstitutional cooperation in help process to the child and family, child and adolescent clinical psychology and assessment and counseling for children and adolescents. About possibilities, it is to deepen the knowledge of family psychology and clinical child psychology, learn the basic principles of family psychotherapy schools, work methods, gain the necessary knowledge about the child and family welfare system, interinstitutional cooperation in health process for the child and family. And about possibilities also that to deepen practical skills in child and family psychological assessments and counseling, and perform practical family cases analysis, task deepen skills in assessment, family needs, recognition, planning, psychological intervention, and psychoeducation to strengthen family resources. And it is very important to add that all lectures of this specializations are also working in practice as children psychologists, teenager psychologists. Giedrė Širvinskienė is associated professor. She works in field of perinatal psychology, and she is interested in children psychology and psychopathology. Ingrida, she works with teenagers, and me, I work as family psychologist and psychotherapist. So you will have possibility to learn practical methods of work with the children and families. We want to introduce you with the main methodologies of assessments, that is echogram, genogram. We teach how to work with this assessment methodologies. They are very interesting tools. Also, we learn how to work using other very attractive assessment tools. It is tree of life, river of life, atom of family. Also, we add other important assessment tools that after finishing the studies, you could feel enough safe to work in this field. And also, it is very important to add that no matter where you are going to work, family psychology will be shadow in your work, because many problems are related to family problems. So that's all. Thank you for your attention.
Thank you, Jolanta. So we would like to ask Associate Professor Aiste Pranskevičienė to share your presentation about specialization in neurology. I will just tell everyone Aiste is very, how to say, reserved on saying good parts about herself, but this year she was chosen as the best psychologist for her impact and her introduction of neuropsychology in Lithuania, and for starting with specialization and for working in this field in clinics for many years. So please, Aiste.
Thank you, Evgeny. So last but I hope not the least, specialization in neuropsychology. Oh, the slides are not moving. Okay.
No.
A little bit of introduction about clinical neuropsychology. So this is the field of science and practice that is quickly developing and a fashionable one. And when we talk about clinical neuropsychology, this is applied field of psychology that aims to integrate the scientific knowledge about links between human behavior and also functioning of the central nervous system and to the principles of psychological assessment and psychological interventions. And during the module of specialization in neuropsychology, we are looking for opportunity to introduce for you to become a little bit more familiar with this area of psychology and to acquire basic introductory knowledge and skills in neuropsychology that will be useful in practical clinical work of a health psychologist. What we aim to introduce, basically, we want to introduce some aspect of neurology, psychiatry, neuropsychological assessment, and also some neuropsychological interventions. And these competencies are very important and necessary by providing psychological services to patients with cognitive and behavioral disorders due to various reasons, due to neurological diseases, traumatic brain injuries, mental or developmental disorders, as well as to healthy people, because this helps to understand how our brain works and how some maybe difficulties arise. And also this knowledge may help you to collaborate with other specialists, especially with medical doctors, neurologists, psychiatrists, to help you in process of psychological assessment, also with treatment planning and selection of interventions. And also these competences can be successfully applied in field of rehabilitation, especially in neurorehabilitation. And also this course aims to develop psychological counseling skills that are important while working with patients and the caregivers, helping them to understand limitations arising from various disorders, and also while participating in planning and implementing of various rehabilitation programs. So generally, where these skills and knowledges can be applied. So this may be applied in various clinical settings, in collaboration with medical doctors, performing psychological assessment, planning interventions, and so on. So generally, these are clinical skills. And the neuropsychological specialization is implemented through 4 modules. And the first module is called Functional Neuroanatomy. And during this module, we will talk about brains, about brain functions, brain neurobiology, and different systems, the healthy functioning, as well as various pathologies. And the next part will be the course of module of neurology. During this course, we will talk about different neurological disorders and the psychological aspects. This will include vascular disorders, epilepsy, dementia, pain, injuries, tumors, and so on. And the third part of the specialization is related to psychiatry and neuropsychological aspects of psychiatric disorders. And during this part, we will discuss all the major psychiatric disorders, both in this traditional clinical way, talking about symptoms, recognition, but also touching the aspect of neuropsychological functioning, biological mechanism of this disorder, and rehabilitation opportunities. And the fourth part is related to neurorehabilitation. and counseling. And in this part, we will discuss various and will practice and try to apply various methods for restoration of lost cognitive abilities due to brain injury or disorder, for example, rehabilitation of memory or attentional processes, visual abilities, or even rehabilitation, neurorehabilitation possibilities in mental disorders. And as my colleagues already told, so one of main strengths of the specialization is opportunity for study in clinical practice. So specialization is implemented in collaboration with Hospital of Lithuanian University of Health Sciences Kauno Klinikos, and separate parts of the specialization are implemented in neurology department, neurosurgery department, psychiatry department, where you will have theoretical lectures, but also you will have possibility to observe, to talk with patients, to perform assessment, and so on. So I think that's all.
Thank you, Aiste, for introduction of this neuropsychology specialization. That was the last specialization we're offering for our students. As you can see, you have a huge, well, not huge, but a good variety of specializations at our university. To pick one, I would like just to let you know that we will not be able maybe to open all specialization because we need at least 5 people to be in one specialization to be able to start it. And that's why it might be that you will need to compromise. For example, if you want I know rehabilitation and we don't have enough people, maybe your second choice will be neuro, for example. So what we're going to do after the application process will be closed, we will come to you once again with a short interview, and we will ask you which specialization you want to study, your number 1 specialization, your number 2 specialization, and then we will open it from September, according to which specializations will get most of your interest. But as you can see from the topics of our specializations, there is some interference between all of them. So no matter which specialization you will get, which you will choose, you will still get the basic knowledge of clinical health psychology and still some part from each. You will still talk about children psychology and problems. You will still talk about health psychology, about neuro parts. So still there is some interference between the specialization. But your task now is to choose your specialization till the end of July, I would say. And we will close not the end of July, middle of July, then we will close the application systems, and Rosa, I guess, or some of us will contact you and ask which specialization you want to choose, because we need some time to prepare, and the specializations are organized in clinics with doctors, so we need to organize everything before we start it.
Also, Evgeny, there is a question by Musa on the chat screen about document formalities. He got a request by us that the documents about his graduation is sent directly from his university, but he's saying that there is a strike across public universities in Nigeria and that it might be a problem now, but he has sent copies and he has originals with him. So I think we can say what you have already said before, that it is not a problem because he will have.
I will comment shortly. So from some countries which are outside European Union, there is a requirements from our education ministry or some other organizations to get directly those documents. Even though you have originals and you are sending the scanned ones, you still need to, the university still needs to provide the original documents and to ensure that you got this document directly from them. So that's why we have these requirements, but no worries, you just inform the person who sent you this requirement that you in Nigeria you have this public strikes and that these documents, this confirmation will come a little bit later, and there shouldn't be any problem with that. Okay, so we understand the situation, but still, university will need to send this confirmation by themselves directly. I have a question.
So can I ask you a question about neuropsychological program?
Specialization.
Yes, about neuropsychological specialization. I wanted to ask, what is like the approach in this program? I mean, is it like American school, or is it some specific Lithuanian school in this in clinical neuropsychology specialization? Maybe a professor who did presentation could like help me.
Okay, thank you. Good question. It seems you already know something about it.
Yes, so, I did have some.
Yeah. So basically, approach is more American one.
Okay.
During neuropsychological assessment classes that are not part of specialization, they are part of complete program. We talk also about this more qualitative assessment. This is more coming from Luria, Nebraska tradition.
Mm-hmm.
But generally, this is more American approach. But it's worth stressing that this specialization is just 10 credits. This is like elective course. This won't give you qualification of neuropsychologist. It's just an introduction. So if you would like to become neuropsychologist, you should check what are requirements in your country. And if you are aiming for qualifications that are in line with United States, so these are much higher. So you should go for PhD and above that.
Yeah, thank you. I mean, for example, if I want to work as a neuropsychologist in Lithuania after practice, I mean, if I will have opportunity, will this degree be enough for me?
Yes, for Lithuania, that will be enough because we do not have neuropsychologists in Lithuania. So in Lithuania, neuropsychologists are people who work in medical settings, and the title is medical psychologist. So that's okay for Lithuania, but it, for example, would be not okay for Norway, because for Norway, you have to graduate from clinical psychology, and then you have this professional education in neuropsychology, which is additional. So you should look for requirements in the country you would like to work.
Okay, thank you. So in neuropsychology, the methodology is mixed, as I understand, right? So it's American and European.
Yes.
So it's more quantitative methods,
there will be both quantitative and qualitative methods. So specialization will give you a lot of basic knowledge about neurology, psychiatry, about functional neuroanatomy, and rehabilitation. And about psychological assessment, we will talk in entire program, not in the specialization.
I would like just to add some things. I still said that it will be 10 credits, but also I don't remember we mentioned it because we had Lithuanian presentation before. So you will do your practice. We motivate students do your internship in that field which you choose for specialization, and also to do your master thesis in that field. So after all, you will have much more than 10 credits in this specialization. Okay, so you will get some scientific knowledge in this field and some practical knowledge and theoretical knowledge, like 10 credits. So overall, it will be quite a lot of specialization, let's say.
Thank you. I also wanted to ask, what is the language of study materials at master's program? I mean, the books, like the articles, are they in English or some of them are in Lithuanian, for example?
They are in English, and I don't know where are you from, but for example, in neuropsychological assessment, if there is possibility to find the same test in other languages, for example, currently I have students that are Spanish speaking and also Arabic speaking. So where possible, I will try to include materials in the native language, but it's not always possible.
Okay, well,
English is the basic one.
Okay, I'm Estonian Russian, but I studied psychology, neuropsychology in Russia. That's why I'm asking so many questions. But thank you. Can I also ask a question, like a general about organization of the program?
Yeah, sure.
Thank you. So, like, how many times per week there are classes?
So usually we have 5 classes per week every day, and the last class on Thursday it was this time. I don't know how it will be organized for next year. Is given for specialization. So every day.
I mean, in master's program, right?
Yes, in master's program.
Oh, okay. So pretty cool. And when is this holidays? You know.
Okay, so we start our studies in September. Then we have few days on in November, but it's not the holidays, let's say. The biggest holidays is the Christmas holidays. So usually it starts from Christmas till New Year, even more for 2 weeks. I will not tell you exactly days for the next year, okay? But approximately 2 weeks from Christmas till usually 6th of January we have it, and then we have Easter holidays. But what is more, few days for Easter, but what is more, after the end of each semester, we have retake week, as we call it. So if you done everything successfully, if you pass all the exams, you still have 1 week of retake holidays for you if you are successful, and that's the end of the last week of January and the last week of June. Okay, I'm talking about retakes. I hope it will not be needed for you, but we have you need to do 1 exam, for example. If you don't pass it, you still have 2 chances to retake it. So that's good.
Yeah. Can I ask you, like, other exams in a written form or in the oral form?
All the exams are in written form,
Okay.
as I know.
Thank you.
Some may be more practical, more theoretical, but still in written form. Okay. But the other not examination, but practice, the seminars, some components of the final grade might be oral, of course. Maybe we'll need to do some practical work, and it will be evaluated.
And also I wanted to ask how crucial it is to know Lithuanian if I want to work as a psychologist, as a health psychologist or neuropsychologist in Lithuania, or is there a need an English-speaking specialist, for example, or I will need to learn like Lithuanian at some point?
Maybe somebody would like to tell it a little bit more.
It will be absolutely crucial to be absolutely fluent in Lithuanian to work as neuropsychologist. But if you said that you are Russian speaking, so I think that
yes,
that there are some regions in Lithuania that have quite high population of Russian speaking people, and you can find a place maybe there easier. But you still will need Lithuanian. Even there are formal requirements, I think, for a working position to take Lithuanian exams.
Okay, yeah.
So you will have 2 years to practice and to study Lithuanian, then 1.5. And if you are from Estonia, you have passport, so you can stay here as long as you wish and to practice language, and maybe you can start in the other position and then to continue.
I also wanted to ask one peculiar question. If I'm going to have a practice in a Lithuanian clinic, do I have to be vaccinated from COVID?
how it is at the moment. At the moment, I guess we are not checking it, but previously, sometimes you needed to have vaccination or to be tested. So
Yeah,
there
and
was
it
this
would
why.
be it would be not possible even to go to classes because classes are in hospital. So if you are not vaccinated, you would be not allowed to enter the hospital. Currently, there are no checkpoints, but if the COVID will come back, so will be a problem.
Yeah.
Okay, so but right now I can go to like
Yeah.
if I study, it's not required like officially to be vaccinated.
No. Earlier it was that students had to do some tests every, I don't know, 10 days or some days
Well,
to prove that we don't have. But at the moment, we are not sure how it will be in the future. So I wouldn't talk much about it, okay? Because we're not sure how everything will be.
Yeah, maybe one more question. Like, when is the latest that I can make decision about the offer, like to sign a contract and to accept the offer? What is the like? Is it deadline in the July?
At which stage are you now? Because each
I paid the 250 euros for registration.
For registration, did you sign the contract?
Not yet. No, I'm. Not yet.
Because your contract, I think, has the deadline written in it.
Well, it's passed, but the contract is still valid. I mean, it still gets sent to my email sometimes.
Okay, so I would recommend to talk individually with Rosa or with Ruta, I guess, who has sent it, and just to talk about this question, okay? Because usually it's written on the contract, but in the case when there is some other issues, we can talk and we can be more flexible.
Yeah, thank you.
No worries. I saw that maybe somebody else also wanted to ask. So it's a good time to ask questions.
I have a question. So there's usually like a big exam at the end of every module, or is there like you have sometimes like smaller exams that go throughout the module, or do you usually just have like this big exam? And I also wondering what kind of reference system do you use? Is it Harvard or is it Oxford?
Maybe I would like Junona to ask you to answer this question. Okay.
Yeah, it seems I have some technological problems. Yeah, I'm sorry for that, but yeah, I didn't hear the question.
Can you repeat, Frederick?
Okay, I had two questions. So is it usually just like a big exam at the end of every class, at the end of every semester, or is there like smaller exams, and what kind of reference system do you use for different assignments?
If I understood your question, okay, the reference style is Vancouver. Usually, APA, maybe it is quite similar. Yeah, Harvard, Vancouver, APA, those three styles are usually used by students. And what concerns exams, you usually take one at the end of each course. For example, I could perhaps tell you about neuropsychology specialization. Some courses are bigger. They can have up to 10 or maybe even 12 credits, but there are also small, such like 2 credits. And in those bigger courses, you have also midterm examinations, but perhaps you do not have one big exam at the very end of all master students, as it is in some universities.
Yeah.
Also, we have a cumulative system, which means that you are doing some practice work, some seminar work, the final exam and everything else, and at the end you accumulate all the grades you got. Okay, is there anyone else who would like to ask? Okay, Yunana, we can see you now.
Yeah, just when I had to speak, I wasn't able to do to show my picture. Okay. But, yeah, I hope that I answered.
Is there anyone else? Odo? Maybe I saw that. Seems like you wanted to ask something. Jamel?
Yeah. No, I don't have many questions. Just one question about like, if I want to travel to Lithuania, do I have to take a vaccination, or because I didn't do the vaccination?
At the moment, it's not needed. And because there is no quarantine, there is nothing which is due to COVID pandemic at the moment. Earlier, what some students had to do, they need to do maybe tests before going to the flight. For example, if there was such requirements, but I guess if everything will be okay, maybe it will not be needed. And also in Lithuania, our international students could do vaccines easier in all the places which are reachable for all the population in Lithuania, so it wasn't a problem to do a vaccine if the students want to do it, of course. Okay, so at the moment, vaccination is not a problem, and hope it will not be in the future, like COVID in general. Also, we can see a question from Emir. Okay, what about the entrance exams? Are there any? I am talking specifically about the master program. If there are some, are they going to be online, or will I have to do them face-to-face and go to Lithuania just for that? So for master program, we do not have any exams.
Can I ask a question?
Just one moment, we're trying to answer it, but later on we will come back to you, okay? So there is no entrance exams. We're evaluating your documents and your
my
transcript.
question is the master program.
Yes.
Can you hear us, Odo? Odo, can you hear us?
Okay. Just a moment. So it seems that Odo cannot hear us. So for master program, there's no entrance exams. For bachelor degree, if your biology or mathematics exams or grades at school were not so high, you can still do biology and mathematics entrance exam, and you can do it online. You just need to register for the exam and to do it. So there is no need to come here. But for masters, no need for the entrance exam. Odo, can you hear us?
Yes, I can hear you.
Okay, great. Can you ask the question once again?
I want to ask a question. Good day, admin.
Hello.
And thanks for giving me the opportunity to be attending this meeting. My first question goes, as a native of Nigerian, and my primary language here, it's English. We use the English language generally as for communication and in education. Do I still need to write the exam of the IELTS?
So for you, it's not needed. And usually we're evaluating English language during the interview. And if we can see that person is fluent in English, we are not asking for extra evaluation of the language. And also, but if you have, you can present it in applying system, and it's a bonus. But
And please,
yes,
Can I ask a second question?
Yeah, sure, please.
My second question goes this way. When I was filling the application form, there was a course for undergraduates and graduates, but it's compulsory that I must fill both the undergraduates and the graduate form, the master's course and the undergraduate course. Will I be doing the both together, or after graduating from the undergraduate course, will they teach me also in practical or in theory?
Do you mean the bachelor degree? Yes, if I understood you right.
I actually filled in for the undergraduates and the master's course.
Fine.
So I was asking if I will be doing the two, or I will have to graduate from the undergraduate course before doing the master's course.
Do you have your education in psychology, your bachelor degree, undergraduate course?
No.
No. Okay.
No.
So in that case, you can only apply for undergraduate, a bachelor in health psychology. Mm-hmm.
Okay. Thank you.
And
I have another question.
Yeah, sure.
Will I be taught mostly in practical or in theory?
It's both. Okay, we're very hands-on, let's say,
right?
practical, yes. And also our teachers, most of our teachers are practitioners, so they are working in many psychological fields. So they will give you the new knowledge of scientific knowledge of psychology, but also different theories, but also they will illustrate it with their practical experiences. And also you will have some practice during the bachelor degree also. Mm-hmm.
Thank you very much.
No worries.
My third question goes this way. I was given an admission. Can I get an accommodation?
Mm-hmm.
If I'm given the admission, can I get an accommodation? Is it in the school premises or somewhere else? Does the school has an hostel for students where I can be given my accommodation?
Yes. So the answer would be yes. University has some dormitories, some hostels for the students. And we try to accommodate all the first year students, but of course you need to be on time. Let's say if you will apply at the last moment, it might be a little bit problem because there is limited spaces, let's say, so the earlier the better. And usually the university dormitories, it's quite simple. You are living together with some other student in one room, and you are sharing bathroom and toilet with another room, and you have kitchen on the floor. So usually that's how the room looks like. And the price is approximately 100 euros per one person. It's the cheapest option, but everything is included, even the internet is there.
Okay.
So after you get...
This was my fourth question.
Yes.
The entrance exam, is it done at the school, or will I be writing the exam here in Nigeria online?
Online. So we're doing the exam online. After you apply for the study program, we checked your documents, everything is okay. Then you can register for the entrance exams, and you can do these entrance exams online. It would be mathematics if you don't have good grades, for example, for mathematics, or biology if you don't have good grades, or both. I hope I could answer your question.
Okay. Thank you. That's my last question. Based on my ERO, who will come pick me up? If I ever gain the admission, who will come pick me up and collect me to the school? Because it's my first time over there.
Okay, understood. If I understood you right, who would take you from the airport? Yes?
The airport, yeah.
Okay, understood. So students can come independently, but if one of my colleagues can call the taxi driver, let's say, and we are coming. Last year it was 50 euros to come. It's approximately 100 kilometers. And this person takes you directly from the airport to your place of living.
Thank you.
No worries.
Thank you.
Thank you for your questions. Do we have more questions? Okay. Okay, we see that Yunona had to leave our meeting. Is there anyone else maybe who didn't ask questions but would like to do? So if yes, this is your time to do it. Don't worry. We will be happy to answer your questions. Maybe to let you to know where you are going and to choose it. Emir, okay, of course you can ask. Can I ask you when am I going to be able to proceed the next step that comes after the interview? After the interview, have you done the interview?
Yes, we have done.
Okay, so my colleagues will send you everything went well, as I understood. You have paid 150, I guess, for application. And now there will be registration. Now my colleagues will send you the contract, okay? And if you agree to study here, you pay 250 euros. That's the next step. And after that, you just need to pay the deposit 1,000 euros, or you can pay directly all the sum of for your studies. That's all. So you are at the end of this procedure. And also in the contract, you will see the further steps and the deadlines for those steps. So very soon you will get it, and it will be more clear and in written form. Thank you, Emir. Anyone else? So the last chance for anyone to ask here during our meetings to get direct answers. If there are no more questions, thank you very much for being here, for asking. Of course, there is still opportunity to ask those questions. There is Rosa, who is working with those who are interested in Bachelor of Health Psychology or Masters in Health Psychology. Also, we have responsible people in the office who are working with your documents, with migration, with application procedures and everything else. So please, if you will find out that there are some questions you still have, don't hesitate. Please ask us. We'll be happy to help you and to lead you to the during whole process of admission. And now, thank you very much. Thank you, colleagues, for sharing your presentations, for answering the questions, and thank you to everyone for being here. And we really hope to see you here in Kaunas.
Thank you. Bye-bye.
Bye.
Thank you so much.
Thank you.
Right, thank you.
Bye.
Bye.